Al, and he's gone now. Sometimes he comes into the room and I channel his soul, and I don't know what I'm gonna say. So I'm sorry about dropping the F-bomb there, but that's what Albert Ellis would say. The goal of all life is to enjoy yourself, and that's what Epicurus said. No pleasure is a bad thing in itself, but the things which produce certain pleasures entail disturbances many times greater than the pleasures themselves. Yes, go have fun, go enjoy your life, but be careful of what you do, because let's say the thing you say, well, I'm having no pleasure. It's a bad thing. So maybe I'll go out and maybe I'll shoot heroin. That's pleasurable. Yeah, for a little while, but certain things produce pleasures that entail disturbances many times greater than the pleasures themselves. So we have to be prudent about what we chase insofar as what would be important to us. So those are the philosophies. Those are the ideas that kind of just undergird what CBT is all about. So now we're going to take that stuff and have the cognitive theory get introduced. Now what I'm going to ask you to do is see if you can imagine something that happened over the last 2 weeks that really irritated you or made you sad, made you feel guilty. See if you could bring up a negative emotion of something that happened in the last 2 weeks. And what I'm going to ask you to do is see if you can feel those feelings right now during this. Language can have a psychological impact on you. But what happened with that lemon, 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 just showed us that it doesn't have to. I mean, when we all repeated lemon, lemon, lemon over and over again, was anyone profusely drooling at that point? No. That's weird, right? I mean, I talk about lemons and you do salivate. You talk about it a lot in a different context. Like nobody's drooling. In fact, what happens if you repeat it over and over, you get cotton mouth, right? Your mouth just kind of dries out while talking about lemons because your tongue's just flapping in the breeze. Your tongue dries out while talking about lemons. That should tell us something. It's not a goofy Psych 101 trick. This is important for us to understand in therapy. The words don't have to have an impact on us. They don't have to. They do. I talk about lemons, you do salivate, you look at it at different some of your behaviors in the service of what you care about, or you're going to stick to some tough behaviors because of what you care about. If you can do this, you're what we call psychologically flexible. The more your psychological flexibility, the lower your scores on psychological distress and higher scores on quality of life inventories. I'll say that again. There's a assessment out there called the Acceptance and Action Questionnaire Second Edition. It's free online, no problem finding it. AAQ2, Acceptance and Action Questionnaire Second Edition. The more psychologically flexible you are according to that measure, the lower your measures of psychopathology, higher quality of life inventory. Pretty neat stuff. So if you care about, as a mental health practitioner, reducing suffering and improving quality of living for your clients, I would look at psychological flexibility as one of your main process measures of what you're trying to do in psychology.